What are the advantages of keyhole spine surgery? When a patient wants to go ahead with a keyhole spine surgery, obviously he wants to know what are the advantages of keyhole spine surgery compared to an open spine surgery. Unless there are significant advantages, there is no point in going for a newer technology. So let me tell you what are the advantages of keyhole spine surgery. Basically, the keyhole spine surgery involves lesser collateral damage to the tissues and higher accuracy and safety in removing the disease. So how does it translate into a real life situation? So in keyhole spine surgery, the skin incision which you are going to take is less than 1 centimeter. So it translates into a better cosmetic appearance. The skin incision less than 1 centimeter, and once it heals, it's usually not seen. It's so small that unless you come very closer to the skin and examine it, you will not be able to identify the incision. So this is much cosmetically appealing, and this is particularly used for young boys and girls or young people who are much worried about the cosmetic appearance. Second, it causes very little damage to the muscle. The instrument the thickness of the instrument is less than 1 centimeter, usually 6.8 millimeter. So when we pass through the instrument, through the skin, through the muscle to the slip disc, the amount of damage it causes to the muscle is negligible. This translates into less post-operative muscle pain, less bleeding, less post-operative stay in the hospital, and early return back to the work. And also it causes less pain on a long term. We call a disease called fail back surgery syndrome, which is common after an open surgery. This is because of damage to the muscle. So after an open spine surgery, these patients can have a new back pain, which is because of damage to the muscle and bones. In minimal invasive spine surgery, because the damage to the muscle and bones is minimal, so the patients will not experience a new pain because of damage to the muscle. Third one, we are not causing any damage to the bone, or we are removing very little amount of bone in minimal invasive or keyhole spine surgery. So naturally, as I have told before, the amount of pain in the post-operative period is less, the amount of bleeding is less, the patient will be able to return back very quickly to work, sometimes within a single day. We will be able to carry on the surgery as a daycare surgery, and the long-term effects because of damage to the bone are not less. And the most important advantages is this keyhole surgery is done under brilliant illumination and a larger magnification and clarity. The safety increases. So the incidence of nerve damage is very low. The incidence of nerve damage is very low, and the chances of removal of the pathology becomes higher. So overall it translates into better efficacy of surgery, higher success rate, and very little complication rate compared to open spine surgery. Thank you.